Hi, ladies and gentlemen, friends and families. Good evening. I am Dr. Mohammed Adil, consultant surgeon from United Kingdom. I would like to share extremely important document which I have retrieved from UK government website, and I thought it might be extremely important for you and your family and loved one to share. The government of United Kingdom and Ministry of Northern Ireland has released a document under the heading Distribution of Vaccine for the Treatment COVID-19 and the Flu Virus. And we have been given 3 weeks for the consultation and to give our opinion whether we would like to take this RNA vaccination or not. Under this heading, there are 5 subheadings. Number 1, authorization of the unlicensed vaccination. I am highly surprised that any medication or any drug or a vaccine has to be licensed within UK to be dispensed or propagated in any other part of the world. But this vaccine, which is RNA vaccine, is known to us, and there has not been many trials and many successes so far before using it as a vaccine, which could be catastrophic. Number 2, civil liability and immunity. The government of United Kingdom does not want to take any liability in case patients suffer from serious consequences of injecting RNA virus, which has no previous proof to be safe. Similarly, all the pharmaceutical companies who are very much linked with the government, they don't want to take any liability regarding the safe injection of vaccine into the human body. And I need to establish the relationship between the pharmaceutical companies and the governments. Number 3, the workforce to be enhanced. The United Kingdom government is trying to make use of workforce of any sort. There could be health professionals, or could be paramedics, nursing staff, or special forces who would be delivering the vaccine from door to door, house to house, and city to city, in order to inject vaccine into the public without having the possible consequences. I would strongly advise health professionals to abide by with the oath which we have taken, that we will not be injecting any poisonous material into the body, or will not encourage anybody to inject poisonous material to our patients, and will do no harm. You have to think about before signing the prescription. Number 4, promotion of vaccine. It's highly unlikely that unlicensed medication can be promoted, which is illegal according to court of laws, and that should be abandoned. Number 5, the wholesale supplier of the vaccine. The United Kingdom want to be the wholesale manufacturer and dispenser of the vaccine to the rest of the world. So that unlicensed vaccine is not a good idea to sell within the country or abroad, which may cause serious problem related to the patient health and safety. So, ladies and gentlemen, if you remember, I had already told you in the month of March or April, in the very beginning of the pandemic, that the vaccination agenda is going to be implemented. Now, the conspiracy theories have become the reality, and this vaccination is at the government side. And I am extremely disappointed by the UK government, who have collected 7.6 billion pound from the wealthier countries, and that money has been handed over to the Gavi Foundation for the safe manufacture and distribution of vaccine. This money could have been used in a better way by improving infrastructure, education, health, and welfare of people. As you know, the UK economy has shrunk to 20%, and this money could have been used for education of the children in school, colleges, and universities. And also, there could have been better use of money for helping poverty and health services in Africa and third world underprivileged countries for the sake of humanity. So my message to the public is, please look at this very important document before you sign it. Once it's signed and the government got majority after your consultation and the viewpoint, then it will become a serious threat because of the legislation which will be passed, and it will become compulsory. So before we reach to that stage, we need to make decision with our family, friends, and loved one. If you like this video, kindly send it to your friends and families and just share that. And I would at the end like to say the time is very short, only 4 days have left, and the last deadline is 11:59 on 18th of September 2020. And I wish you and your family very best of everything. All the best, Dr. Adil from UK.